Good evening. Welcome to SpectraCell's 2018 Thursday night webinar program. Tonight we have a special presentation for you, Vital Strategies in Cancer, presented by Dr. James Roach. This webinar is being recorded and you will receive an email once the on-demand version is available. Slides and educational materials are available for download in the resource box on the left of your screen. You may submit questions in the Q&A box. If time permits, we will answer these at the end of the presentation. At this time, I would like to welcome Dr. Roach.
Thank you, Ms. Owen. I so appreciate the invitation. I'm honored, I'm humbled, and I really appreciate SpectraCell inviting me to give this. I love to share information. Put on your seatbelts. I've got 193 slides to go through. That's less than 20 seconds per slide. You're not going to have time to write down information about each one of these slides, but you will be able to get back on the SpectraCell website and review all of this information. So sit back and relax and enjoy. Here we go. So what are we going to learn with this webinar? First, what free intervention is more effective than chemotherapy? Why is leptin so important in cancer, and how do you address it? What are safe ways to support sleep in cancer? What are the best supportive strategies in chemotherapy? And what 3 micronutrients, when you see higher levels, can signal cancer? How does sleeping 6 hours a night impact risk? What are 3 key advanced strategies in cancer? And could hope be the most powerful force in cancer? The initial visit is crucial. You know, that first week, according to the New England Journal of Medicine, the risk of suicide is 12.5 times higher. The risk of heart attack, 5.5 times higher. You want to counsel your patients as soon as they get a cancer diagnosis to come see you first to get these issues addressed. The incidence of venous thromboembolism, 53 times higher in that first 3 months. And it continues to stay elevated even up to 10 years out. So you've got to do that. We don't want your patient dying from pulmonary emboli. So there's a 28-fold higher risk in hematologic cancers. And if you have a distant metastasis, that likewise increases risk 20-fold for venous thromboembolism. With cancer, we need to be comprehensive. You know, we're all like a giant jigsaw puzzle. The more pieces we put into place, the better the outcome. So we need knowledge of the cancer, including tumor markers, which is through Caris Lab or testing of chemotherapy options, which you can do through Dr. Weisenthal and Dr. Nagorny. We need knowledge of the external environment. You want an attractive living area, toxin-free, mold-free. At work, you need that to be a positive energy environment. You need to balance your lifestyle, and relationships are especially important. They're very nurturing. They're positive energy. So we need knowledge of the terrain, including micronutrients, hormones, cardiometabolic factors, detoxification ability, you know, what's promoting angiogenesis, growth of blood vessels and tumors, what's impacting circulation, and as important as anything, spirituality. You know, cancer-free survivors, 22% of them are supplement users. But I'd rather be in the category, I don't know about you, but I'd rather be in the category of the cancer survivor. 33% of those were supplement users. Supplements make a big difference, certainly in my clinical experience of this about 13 years. So chemotherapy depletes nutrients, so consider micronutrient analysis at diagnosis and soon after prolonged chemotherapy. Can chemotherapy reflexively promote cancer by generating nutrient deficiency through generation of cancer stem cells? The answer is yes. So comprehensive blood work can include SpectraCell micronutrient testing, hormone balance, thyroid panels, cardiometabolic, but also looking at blood count, chemistry profile, C-reactive protein, and all of the rest of those listed there, HO2/NU, galactin-3, estrone sulfate are important. We'll get into that a little later. So let's begin with vitamin B1, thiamine. It's essential to treat deficiency, research suggests, but only with strict RDA amounts. So use larger amounts than that. It actually is tumor promoting, research suggests, unless you use very high doses, and that's too risky to try to titrate exactly the right amount. So I recommend, you know, using only very minimal amounts and perhaps supporting with food sources is the best way to manage that. And with vitamin B2, however, it is particularly helpful. It blocks aromatase. Remember, that's testosterone to estrogen, and blocks 5-alpha reductase, testosterone to dihydrotestosterone, which is generally exactly what we want because both estrogen and dihydrotestosterone are tumor promoting. So vitamin B2 has protected against breast cancer risk, colorectal cancer, squamous cell esophageal cancer death. And however, very high doses, remember the dosing is important, very high doses in cell lines increased tumor promoters and enhanced invasion migration. And during chemotherapy, vitamin B2 can promote cancer stem cells by supporting their mitochondria, research suggests. Vitamin B3, you're familiar probably that nicotinamide has been associated with reduced incidence of non-melanoma skin cancer, like a 30% reduction in squamous cell cancer, 20% in basal cell cancer. However, B3, like niacin, associated with a higher risk of colorectal cancer, 18% in one study. Look at this, niacin intake in premenopausal women associated with a 62% increase in estrogen receptor, progesterone receptor positive breast cancer. Why is that? Well, actually, it makes a lot of sense because, niacin is an anti-methylator. Remember B2, B6, folate, B12? As methylators generate glutathione to help get rid of toxins and estrogen metabolites. So B3 does the opposite. Homocysteine levels go up associated with that. When homocysteine is a toxin in and of itself, it's also a marker of toxins and also promotes clotting when the levels rise. When you give niacin, that raises blood sugar levels, and tumors love blood sugar. There's not much research on vitamin B5. I did find this one study in a mouse model with ovarian cancer where it did appear to slow tumor progression and reduce metastasis. So in a deficient individual, you do want to support that. And if you have a deficient patient with niacin, you would want to very gently address that, of course. Maybe NADH would be a way to consider that. Might help some with cancer-related fatigue. So looking at vitamin B6, very, very important vitamin here. Look at this. Associated with a 34% lower risk of all cancers, gastrointestinal cancer, breast cancer, nasopharyngeal, lung, kidney cancer. Those are substantial numbers there. Why is it so effective? Well, it helps the body get rid of estrogen metabolites, right, via the transsulfuration pathway, homocysteine down to glutathione. And so glutathione, again, helps eliminate estrogen metabolites. And when you get birth control pills, what happens? 75% get deficient in vitamin B6. So those women are at risk for tumors associated with that. You saw that recent research, right? 20% higher incidence of breast cancer, for example, associated with birth control pills. And when you check on the micronutrient testing, when you see vitamin B6 at a normal level, don't relax just yet. You want to also look at vitamins B1, B2, B3, biotin, magnesium, and zinc. Why? Because all of those help convert B6 into the activated form. How do you know if you have enough activated vitamin B6? Well, are you remembering your dreams every night? That's the simple way to know that. So I titrate pyridoxine 5-phosphate, P5P, 50 milligrams. I start with one, maybe 30 minutes before supper because it's calming, relaxing at about 85%, but stimulating at about 15%. If it's relaxing, then I move it to bedtime, and every 3 nights maybe increase the dose to a maximum of 200 milligrams or 4 pills per night. You may get vivid dreams, back down on the dose. But whenever you're dreaming every night, that means that transsulfuration pathway is working. You're getting rid of toxins. You're getting rid of estrogen metabolites, and you're converting glutamate. Remember, MSG, monosodium glutamate, is an excitotoxin. You're converting that into the calming, relaxing GABA, which is so important in these patients. So therefore, vitamin B6 depletion leads to overstimulation, excess estrogen, and so patients who are anxious are usually high estrogen due to COMT, CBS, MTHFR gene mutation, and they're low in vitamin B6 typically. So they spend their time in fight or flight. They may not have had a single peaceful day their whole life. They may have been in fight or flight every day and therefore highly vulnerable because they're not getting rid of toxins, they're not getting rid of estrogen. That estrogen attracts negative energy into their life, and then they experience trauma, and because they can't break down adrenaline, because of COMT, because they can't convert glutamate to GABA, they experience PTSD and carry around that baggage with them for decades, and that's essential to address at the first visit. So folate, and as a methylator, helps get rid of estrogen and other toxins, and so reduces risk of cancer, colorectal, nasopharyngeal, breast cancer with these studies. B12 similarly is protective. Look at that. It's associated with a 5.8-fold reduced incidence of gastric cancer and a higher risk for breast cancer. But, with serum B12 levels, when you see a high blood level of B12, that may indicate cancer. And so particularly hematologic malignancies can be associated. It's associated with higher clotting risk, associated with liver and kidney disorders. But high serum levels, blood levels of B12, can be associated with low intracellular levels of B12. I had a patient who had weakness and numbness and tingling in her upper extremities. It was very disabling for her. Her B12 level in the blood was toward the high side. But when we did spectral cell micronutrient testing, it was in the bottom 1%. Who was right, the blood or the spectral cell micronutrient? Well, I gave her a B12 injection, and she said it was like a miracle. Her weakness and her paresthesias in her upper extremities disappeared. So that's what you want to pay attention to as far as B12 is what's going on inside the cells. And there are a number of factors that can impede, the transport of B12 from the bloodstream into cells. If you have gene mutations, GIF, TCN1, TCN2, or maybe you have a lithium deficiency that's impairing that transport. So high blood B12, again, associated with higher risk. And however, in patients that are entering hospice, I had a patient who did really, really well with her ovarian cancer, but finally that time came. She still was really energetic, but she did request some B12 injections, and I gave them to her while she was in hospice, and that really energized her. So she wasn't in bed. She was up and about doing things. She lived about 2 years, but she died with a smile on her face. And really, cancer transformed her in such a positive direction. She was kind of a crabby individual prior to the cancer diagnosis. After the cancer diagnosis, it was like a metamorphosis. She loved life. She was driving in a red convertible with a red scarf flowing in the breeze. Serine, I don't recommend in cancer research. It's kind of concerning. Can be used by cancer to promote growth. So focus on food sources with serine would be my recommendation. Now, the American Journal of Clinical Nutrition in 1995 in May demonstrated that 2 grams of glutamine associated with a 4.3-fold increase in growth hormone. More than any other nutrient, glutamine promotes growth hormone, and growth hormone is not a good thing in cancer. It promotes cancer cell survival and growth. Now, but let me go back there for a second, because certainly, when you have surgery done, when you go in the hospital, your glutamine levels plummet. Without glutamine, that can compromise your intestinal tract. But I would suggest in those situations supporting with like homemade sauerkraut, or you can juice cabbage as a way to get glutamine to help protect your intestinal tract in those situations. Asparagine, we've known for some time, is associated with higher risk with hematologic cancers. In fact, there are cancer drugs designed to help break down the asparagine. And now there's new research even suggesting with breast cancer that asparagine could be an issue. Is that a reason to totally avoid asparagus? I'm not in that camp yet. Asparagus has a lot of other good things to it. Yeah, if you have a hematologic cancer, I may not want to consume any of that. But other cancers, I think a little bit of asparagus is okay. Moderation is the key with a lot of this, right? With choline, choline is fascinating. So we mentioned about B12, high blood levels associated with cancer risk. Choline is the same way. When you see high choline levels, you may want to think cancer or want to screen to rule out cancer. But choline has a lot of beneficial treatment effects, particularly when you provide it nutritionally. So it addresses cancer stem cells, just like a number of other things. We're going to get into that later. Vitamin D, vitamin A, and a number of ones listed there. But I tell you what, I can tell you how to get 50 of those. We'll talk about that later. There was one study, choline-deficient fatty liver may lower risk of metastases. So all cancers tested so far display abnormal choline metabolism, one study reported. And so once again, high choline associated with 3-fold high risk of colorectal cancer. But again, choline is what? It's a methylator. So normally it helps get rid of estrogen and toxins. So higher dietary intakes of choline associated with 66% lower risk of primary liver cancer, for example. And also in combination with betaine, lowered cancer risk 40% in one study. Inositol, I really love inositol and highly recommend inositol in this type of situation. Remember, it's essential to get your patient at peace. Inositol can help get them there. If you're panicked, remember it can help promote cancer growth. And inositol has been proven to work as well as an SSRI antidepressant for anxious depression. It's a good hormone modulator. It lowers estrogen It lowers dihydrotestosterone. Remember DHT, that's the one that promotes male pattern hair loss, hair growth in unwanted places, complexion issues, bossiness, aggressiveness. You can recognize individuals that have those issues. So my polycystic ovarian patients love inositol. But in cancer, the research has been done with inositol IP6, so that's what I would recommend that you use. It's been demonstrated to be beneficial in prevention of cancer, cancer control, anti-angiogenesis, that is growth of blood vessels, protects against metastasis, and enhances chemotherapy and hits these key markers that are listed there and improves blood sugar levels, insulin sensitivity. Carnitine deficiency is especially common in cancer cachexia. Deficiency associated with elevated C-reactive protein, not a good thing because that promotes angiogenesis. Radiation reduced carnitine levels, and carnitine after radiation helped reduce heart damage and is an antioxidant. It's important specifically when you're using doxorubicin, platins, cyclophosphamide, and it reverses, obviously, the deficiency without impacting the efficacy of those chemotherapies and protected against nerve and heart toxicity. Oleic acid, omega-9, is found in olive oil, for example. Also, there are products on the market that are omega-3, 6, 7, 9, for example, Complete Omega Essentials is one that I use, and it inhibits cancer proliferation in vitro and in vivo. It may suppress overexpression of HER2. It plays a key role in several human cancers and the cause invasion and metastasis and induced apoptosis. Vitamin D is real important. I'm going to go back to oleic acid for a second because some people say, well, avocados are a great way to support that. However, avocados, despite all the good things they have, are high in copper. So in cancer, that's not a good thing. That doesn't mean you can't ever eat avocado, but if you occasionally eat avocado, take a zinc afterwards to neutralize that. Now back to vitamin D, really, really important. My very, very first integrative cancer patient, a prostate cancer patient, sent home to die by his oncologist. His vitamin D level was 16. I put him on ever-increasing doses of vitamin D. It was only when I got him on 50,000 units of vitamin D3 a day that his blood level reached 65, kind of the mid-range of normal. But when that happened, along with tweaking it and a few other things, his PSA level started to drop. It went from 225, next month to 220, then 215. Then he went down to Texas, heard about a doctor there, and they said, stop all these nutrients that you're on. 2 weeks' time, his PSA skyrocketed to 100 points. And the cat was out of the bag. We couldn't get him back under control. So what does vitamin D do? It boosts testosterone blocks estrogen. Remember, in essence, blocks aromatase, blocks, in essence, 5-alpha reductase, lowering dihydrotestosterone. So exactly what you want in cancer patients. So it's been demonstrated to help prevent up to 16 different cancers. Some of those are listed down below. So very important to get vitamin D, vitamin D3, of course. So vitamin K in a meta-analysis improved long-term survival, for example, with liver cancer, and has other beneficial effects associated with that. And of course, when you get vitamin D, that suppresses other fat soluble nutrients. So especially important to support vitamin K2 with that. You remember K takes calcium from arteries and puts it into bones. So protects against bony metastasis associated with better outcomes as far as mortality. This research demonstrates, particularly in prostate cancer and lung cancer. So vitamin A reduced melanoma 40% when used in lower doses. However, bigger doses by suppressing vitamin D may not be beneficial. For example, 5,000 units has been demonstrated increased fracture risk. So vitamin A may inhibit progesterone-promoted breast cancer metastasis. Some eyebrows are going out there. Yes, there is some research showing that if you have breast cancer, that progesterone, I've seen 3 studies, at least there are others beyond that, promotes metastasis in those individuals. So if you're treating a patient, with bioidentical hormones and you don't know about this silent little breast cancer, are you actually promoting metastasis? Well, maybe. So low vitamin A and vitamin E levels at renal cell cancer diagnosis worsen the prognosis after surgery. It's particularly important, using vitamin A and folate when you're addressing human papillomavirus, HPV. And, my mentor, Don Jansen, told me that he had 100% success, and I as well, in treating cervical dysplasia. I've seen essentially 100% success using localized vitamin A and bigger doses of oral folate, like I use 5 milligrams of methylfolate in those scenarios. And most squamous cell cancers are human papillomavirus induced. So manganese supports superoxide dismutase. That's good up to a point. But if you get too much SOD2 activity, that actually can promote tumor activity. So this is some of the research related to that. So once again, measure the level and replace conservatively is the rule here. With calcium, it can increase risk by increasing estrogen via aromatase. It promotes constipation, which means you don't get rid of toxins and you don't get rid of estrogen metabolites. You end up recycling those. In prostate cancer, 500 milligrams increased risk 60%. 2,000 milligrams actually tripled the risk. However, in colon cancer, it appears to be protective and also potentially in ovarian cancer. Copper may be the main switch that triggers angiogenesis in cancer. It's found in high levels in many progressive tumors. And you can bring the check and spread of cancer, particularly in stage 4 cancer, if you get them, whether chemotherapy or surgery has gotten rid of all visible tumor. If you deplete that copper, then you can prevent potentially those patients from developing tumors with a blood supply and can put them in permanent remission. The risk of dying is increased with high copper and with high iron. Ceruloplasmin is the storage form of copper, and I use that as my monthly monitoring of the copper status. So a reliable marker really clinically we find in all cancers, including those demonstrated. So zinc, has anti-cancer properties, including calming, antidepressant. It promotes intestinal integrity. Remember, zinc hits 120 different enzymes in the skin, but think of the intestinal tract as like internal skin. So zinc is wonderful for healing, the intestinal lining all the way up and down. It has a little bit of anticoagulant effect. It lowers glucose, and it's anti-inflammatory in its effect as well. It's an excellent aromatase blocker, which is exactly what we need in these situations. I want zinc at the top end, the very tip-top level. And again, it directly opposes copper. It's my top recommendation for lowering copper. Number 2 is molybdenum. Number 3, alpha-lipoic acid, and then N-acetylcysteine. So it also reduces tumor-promoting iron. That's some of the research with zinc. With magnesium, 39% higher cancer risk when magnesium levels are particularly low. With the highest dietary magnesium, 20% less thyroid cancer. However, there was one study, I'm not sure I believe this, in breast cancer, magnesium increased the tumor growth. I think we need more research before we comment on that. However, I think there may be a place for using magnesium when combined with taurate, which is taurine, right? That's that great antioxidant. Remember, that's a sulfur molecule which supports detoxification is one way to think about that. So if you use magnesium taurate, research suggests that may block cancer stem cells because of the taurine effect. I do not recommend the glycinate form in cancer because glycine promotes growth hormone. So low magnesium is particularly prevalent in cancer. We recommend 2 to 3 bowel movements a day. It helps eliminate toxins. It prevents recycling of estrogen. And a little bit, it blocks testosterone conversion to estrogen. And particularly important with platinum chemotherapy, partly because you get constipation with platinum chemotherapy, but it also improves the efficacy, research suggests, and protect it against kidney and nerve injury. Now, vitamin C, dietary vitamin C is associated with lower risk of breast and lung cancer, esophageal adenocarcinoma as well. And deficiency is frequent in cancer, but vitamin C increases iron absorption, and that tumors love iron. So that's a real problem. So I don't recommend regular supplementation with vitamin C. So only if you have a documented deficiency, and I would probably only support that gently with nutrition rather than giving supplements. Of course, intravenous vitamin C, very different because it's a toxin actually. And for example, research demonstrated it killed 50 to 60% of colon cancer stem cells. And leukemia, likewise, it regulated cancer and helped as far as cancer stem cells. With selenium, it blocks estrogen, it blocks dihydrotestosterone. Remember, exactly what we want, supports detoxification via glutathione as well. It helps escort mercury out of the body as well. So it's been demonstrated to suppress cell proliferation, enhance immunity, and higher levels are associated with reduced incidence of bladder cancer, Look at that with prostate cancer, but it's a U-shaped curve, endometrial cancer, and other cancers as well. And laryngeal cancer associated with much higher 5-year survival when you have sufficient selenium levels. So you can see an initial selenium level on the micronutrient profile, and if it's low, monitor those levels to be sure those come up really in the upper end of the normal range is what I would recommend on selenium. Look, in breast cancer, it helps with 5-year survival, and the low selenium group were 149% more likely to die. In cancer stem cells, selenium helps modulate the signaling pathways. Tocotrienols, very important, something you definitely want to consider in your cancer patients. Look at all those key factors that are cancer promoting that tocotrienols help address. So it promoted apoptosis, anti-tumor immunity, chemosensitization, and has anti-cancer stem cell effects, research suggests. There's brand new research suggesting that gamma-delta tocopherol in combination with gamma-delta tocotrienol may be even more effective than tocotrienols by itself in preclinical animal models for both cancer prevention and cancer therapy and control. Tocotrienols bind to estrogen receptor beta. That's the one that's associated with bone and brain, so should protect against bone and brain metastases. Alpha tocopherol, which is the kind in the regular multivitamins, is not effective. It's not one that you want to use. It may have some blood thinning qualities which may be beneficial, but does not have the tocotrienol is so much more powerful. Alpha lipoic acid lowers blood sugar and detoxifies. It hits nuclear factor kappa beta, the master inflammation switch, reduces angiogenesis, and therefore helps with inflammation, lactic acidosis, and hypoxia. It inhibited cancer initiation and promotion in vivo, anti-cancer stem cell-like properties. Remember, it helps lower copper levels as well. So coenzyme Q10, many cancers are associated with lower CoQ10 levels, for example, breast cancers and multiple myeloma. Fatigue in breast cancer was significantly improved when coenzyme Q10 and L-carnitine were used. I think dosing is important here. You don't want to give larger doses, just what data, and try to document the deficiencies again before giving that. So cysteine and acetylcysteine is what's most familiar, has anti-cancer properties. Those are listed. In combination with resveratrol has benefits. However, avoid N-acetylcysteine prior to radiation therapy as it protected cancer stem cells. A high percent of metastatic cells have high glutathione levels. Glutathione promoted metastatic foci, facilitated metastatic cell survival and growth. Once again, some of you are scratching your heads because a lot of integrative practitioners use intravenous glutathione. Now, I don't have experience with that. Maybe they're seeing good outcomes clinically. All I can say is this research is very concerning to me. Now, maybe if you used IV glutathione right prior to chemotherapy, that might be an ideal time to consider that. Glutathione is the main way cells protect themselves from chemotherapy and from radiation. So in the days of multivitamin number, we're all unique. Our vitamin needs are unique. If you give a multivitamin, that might aggravate your gout due to the niacin in there. You might get a big flush, right? And if you're estrogen dominant or have cancer, then there's copper in the usual multivitamin, and that's going to make things worse. So, I don't recommend a multivitamin in my cancer patients. Each vitamin offers risks and benefits. We must measure these and understand these. So you can do hormone testing, prolactin. When that's high, that's a lot like estrogen dominance. For the same reason, you need to bring that down because it's going to promote angiogenesis. So Vitex and Sage, which has a cerulic acid, helps modulate that. With sex hormone binding globulin, higher levels bind up estrogen. So berberine and prescription metformin help boost sex hormone binding globulin to help bind up that excess estrogen. And typically, when you have high estrogen, that leads to low free testosterone due to the higher sex hormone binding globulin. And so all those nutrients listed there help block aromatase, boosting free testosterone, which is needed to support the immune system. With IGF-1, it's a marker for growth hormone for diabetes. Higher levels promote tumor growth. Dwarfs do not get cancer, okay? So that tells you how powerful growth hormone is in tumors. So you can inhibit IGF-1 with the nutrients listed there. With DHEA, research does show, even though it's a weak hormone, positive association with estrogen receptor breast cancer. And after menopause, increased breast cancer is associated with higher sex hormones, estradiol, estrone, androstenedione, DHEA, and even testosterone. And part of the testosterone connection is, one, it gets metabolized sometimes estrogen, right? And then also some tumors have androgen receptors to some extent. So with thyroid, hyperthyroidism increased the risk of certain solid cancers, likely those with estrogen receptors, such as lung cancers, melanoma, as well as the sex organ cancers. And spontaneous hypothyroidism may delay the onset or reduce the aggressiveness of other cancers. So I target, a TSH of, say, 5 to 10 in my patients. Thyroid hormones are implicated in causing cancer and metastasis, particularly levothyroxine associated with higher breast cancer risk, for example. Free T4 in the highest third doubled the risk of mortality compared to the middle third. And meanwhile, lower thyroid function, again, can be an adjunct therapy against cancer proliferation and angiogenesis. And so there's just further research in that direction. So, 233% high risk of breast cancer with thyroid disorders. And look at this. In women less than 45, the risk was 14-fold higher. So you want to keep that in mind and be sure those women get their breast exams regularly and get dietary advice and other advice on protecting against breast cancer. The higher free T4 increased breast cancer risk 14%. So insulin increases estrogen. Actually, it promotes aromatase and increases risk for a number of cancers. In postmenopausal women, breast and endometrial cancer risk. With lipids, remember, these patients are high risk for heart attack and stroke. I don't think I mentioned this, but, I have, in treating my patients, none of my patients have had a heart attack or stroke that I've been treating over the last 12, 13 years. And just a handful have had just a mild thrombophlebitis. But I had an individual who ignored my recommendations. 1 month later, he was dead with a heart attack. I had a farmer with pancreatic cancer, ignored my recommendations. He developed veins in his legs that were so thick they were like big ropes going. It was the most horrendous thing I'd ever seen. So this is preventable. Your patients don't need to have heart attack, strokes, and you largely prevent thrombophlebitis as well. So, red yeast in patients that have particularly high hormones, you consider red yeast extract. Be sure to get a quality source with that. Bergamot is another statin-related botanical that has been demonstrated to improve LDL, HDL cholesterol, as well as triglycerides, small dense LDL particles, and improve buoyancy, and is an mTOR inhibitor, which is important in cancer. With C-reactive protein, inflammation, a key driver of angiogenesis, target a level below 1. And monitor these levels every month. If you see the level rising month after month, you need to get more aggressive in that cancer management. Hemoglobin A1c, again, tumors love sugar. I target a level of 5.0. You have to treat more aggressively than what the A1c suggests because there's more rapid turnover of these cells in cancer. So you can support normal blood levels with alpha-lipoic acid, black cumin seed oil, inositol berberine CoQ10, Gotru, which is the precursor of prescription metformin, right? And then turmeric curcumin. Homocysteine is, remember, a marker of animal product consumption. Remember, I had an alcoholic whose level was really, really high. I didn't realize he was alcoholic. I couldn't get it down until he joined AA. And then his prostate cancer stabilized after that. That was the main driver of his cancer, actually. So I recommend actually trying to normalize that by eliminating animal products and increasing leafy green vegetables. Adiponectin produced in fat cells is actually roughly beneficial compared to the archipel and leptin. These are nutrients that help optimize adiponectin levels. So leptin increases aromatase, that is, increases estrogen, promotes cancer cell proliferation in cancer stem cells, inflammation through IL-6, IL-8, promoted angiogenesis. Look at all those markers that leptin promotes. And also HER2/neu is part of the mix. And so look at the ratio of leptin to adiponectin. I think that's the best way to look at that. So if you see a leptin-adiponectin ratio of about 1.91, again, higher risk of associated postmenopausal cancer by about 90%, and obviously worsens the prognosis with that. With a blood count, You want to look at platelets. Platelets have growth factors in it, so they directly promote cancer growth. And of course, they also promote clotting, which you're trying to avoid. So if you see platelet levels rising month after month, you need to get more aggressive in managing that tumor. Likewise, if you see neutrophil lymphocyte ratio rising, remember, neutrophils characterize what? Inflammation. And so you know when neutrophils are rising, that's not a good thing. Target a low glucose. You want that albumin up to be 4.5, right? 3.2, I see so often, you have suppressed immune system when that's low. So you might want to recommend duck eggs. If you can find duck eggs, we can find them in this area. Duck eggs have more nutrients in them. They're actually alkaline as opposed to chicken eggs, which are acidic. So maybe consider that. Or if not, chicken eggs that are organic, because eggs are readily digested and readily absorbable. I'll recommend up to 6 eggs a day if you have a really low albumin to bring that up. Now, I want LT to be really low because that's a marker of how well the liver is working. We want the liver working well to get rid of toxins and to get rid of estrogen, correct? D-dimer, a breakdown product of clots, a marker of clotting inflammation, and the cancer status. Once again, this is something you want to monitor monthly, a risk factor for heart attack, stroke, thrombophlebitis, and thick blood promotes cancer growth and metastasis. And it's higher during and in the weeks after chemotherapy. So, your risk of heart attack and stroke and so forth are higher at that time, especially important that they're on measures to keep circulation going. Tamoxifen, raise D-dimer levels. However, when looking at D-dimer, if you see a high reading, you might want to ask, well, did you have a cold or are you having a sinus infection? Because that may be why the D-dimer is running higher. And you can support normal D-dimer level with systemic enzymes between meals. Now, if that patient has a burning, gnawing stomach, or if they're bleeding actively, you don't want to give systemic enzymes because that's going to inhibit that healing right and promote the bleeding. But once they get stabilized, systemic enzymes are important. Fish oil, turmeric are helpful. In my pancreatic cancer patients, now I find it very important to start them immediately on heparin, 5,000 units every 8 hours. And I had a patient recently who I was able to double the outcome, particularly using that heparin, though many other things you can do in those types of cancers. Warfarin's not a good choice, right? It suppresses vitamin K, and that leads to weaker bones, increasing metastasis risk. With fibrinogen, target less than 375, a very important cancer marker, particularly in pancreatic cancer. Once again, a marker of inflammation and clotting risk. Stay well hydrated, get plenty of fiber, but get the fiber like at supper time, away from when you're taking your nutrients. Normalize weight, cholesterol, blood sugar, and once again, consider heparin with that. These are nutrients that are helpful with fibrinogen and others that are helpful as well in references. So you learned about ceruloplasmin and zinc and how important it is to check those. Look at HER2/neu levels in the blood. So check regardless of the tissue marker status. Now, it's not all cancers, but certainly, most cancers are more prone to looking at that. So see if HER2/neu is relevant to the cancer you're dealing with. And a number of strategies, HER2/neu associated with angiogenesis, with more aggressiveness, because, if there's a tumor cell that breaks off from the primary, it's more likely to be HER2/neu positive. So when you see HER2/neu levels rising, it may be an indication that patient is having metastasis. So these are some of the ways to help address HER2/neu listed there. Other markers, estrone sulfate, storage form. Remember, estrone hits the alpha estrogen receptors more than the beta receptors. Those are the ones on the sex organs, and therefore is particularly associated with higher cancer risk and cancer progression. And so you definitely want to get those levels lower. I even use estrone sulfate as a screening test in my healthy patients. LDH, a marker of lactic acid. We want acid levels to be low. If tumors are generating lactic acid, that breaks down the surrounding tissue and allows tumors to be more invasive. Potassium bicarbonate can help neutralize acidity and help protect the bones. I have my patients check, the first or second morning urine pH. You can look at other markers as well. I don't find CA15-3 or CA27-29 be that reliable. They fluctuate too much, so I don't do those. Beta-2 microglobulin is a good one to look at in leukemia and with lymphoma. CA19-9, of course, with pancreatic cancer. So monthly, these are the tests that I want my patients to be getting. And every 3 months, these are tests I want them to be getting. So leptin, if that's high initially, monitor that and see how those leptin levels are doing. At 6 months, you may want to consider particularly if patients had chemotherapy or if they had cachexia, consider doing the micronutrient testing. And you may want to repeat the cardiometabolic and the hormonal testing at that time as well. So look at these things you want to be doing at the initial visit. And, just get a checklist and check off when you address these, because it's such a crucial time. Because if the patient makes a mistake by getting surgery inappropriately or getting the wrong chemotherapy, you can't backtrack from that. So do things right from the start. Here we go. So first of all, thanks, Dwight, the key is not a medical emergency when you have cancer. It's a psychological emergency. It's a good integrative program, can give you time to research your options. Now, there are exceptions. If you have small cell lung cancer, a few other situations, it can be urgent. However, almost 90-95% of the time, if you get on a good integrated protocol, that gives you time to study and research to find the best options. Why is peacefulness so crucial? Stress-induced neuroendocrine activation increased breast cancer metastasis 30-fold in mice. 30-fold, dramatic. And propranolol, which is a beta blocker, blocks adrenaline, most of the time was able to inhibit those metastases. So peace is achievable through the lessons of spiritual near-death experiences, complete forgiveness, supplementation, prescription propranolol, lifestyle interventions. Also, you want to have a family or patient advocate because you want protection against the negative energy of perhaps the oncologist or other treating practitioners or even neighbors and so forth. Keep your cancer patient away from negative energy. So I asked my cancer patient, what's your life vision? What are your passions? And immediately you find out where the patient is in life. They say, what are you asking? They're lost. And if they say, well, my family and God, that's what's important, then they're spiritually grounded. That's important information. Remember what Einstein taught, E equals MC squared. We look at each other, we see solid mass. In reality, we're just energy fields. That explains, a mother's intuition. How does a mother know that her child, the other side of the world, has something wrong, but she knows it, right? Mothers out there, you've experienced that. How can you explain walking on hot coals and not burning your feet? That's quantum physics, understanding that. I've had 53 patients with spiritual near-death experiences in my practice. And these patients report the other realm is more real. Maybe they're all lying to me, but I don't think they are. And they report they get mad about coming back. They're not afraid of death anymore, and they become very mission-oriented. And I thought, boy, actually, that's kind of nice. I don't want to fear death. What if I could teach my patients? They did not need to fear death. So consider reading Sam Pernia's book, Erasing Death. Even Alexander, he's the Harvard neurosurgeon, Proof of Seven. This is for your patients to read, to help them understand about near death, and share these stories with them. And, are you on your spiritual pathway is a question you want to ask. Are you doing what you love to do that makes the world better? Are you bringing love into the world? Because if you're on that spiritual path, what our near-death patients are telling us is that if I, as the practitioner, does everything wrong, if the patient does everything wrong, then the downside is ultimate bliss. That's the downside. They don't have anything to worry about. Now, their family may not be so happy, right? But the patient's going to be fine. Now, if they've not been on their spiritual pathway, you might want to read my book, God's Cow Skulls, about the consequences associated with that. Forgiveness is huge. Emphasize at the initial visit that it's paramount to forgive yourself and others. Think about who it is that gets cancer. It's not the laid-back individuals that get cancer. It's the individuals that are estrogen dominant, meaning, remember, they can't they cannot convert glutamate into the calming, relaxing GABA. They can't break down epinephrine, right, into its metabolite due to COMT mutations. So the estrogen dominant individuals are overstimulated, which means they're very vulnerable in their life. First of all, they have high estrogen that attracts negative energy in their life. That's not a good thing. And then when they experience trauma, they don't run away. They freeze and panic. And then their adrenaline kicks in so high they can't metabolize. They end up with PTSD, and they carry that around with them for decades. So it's essential for these patients, for the ones that are prone to get cancer, to forgive themselves and to forgive others 100%, because that's a yoke on their immune system that's weighing them down. So get them to work on that. And as far as abuse, read the book, have them read that book, Waking Up in Heaven. She experienced almost every kind of severe abuse. So there is hope important. Well, the paper Voodoo Death, Australian Aboriginal, another one. Hexed individuals die within 24 hours. And, so many oncologists will say, well, you've only got 3 weeks to live. You better get life in or 2 months to live. And, of course, patients are going to live exactly 3 weeks or 2 months because that's what they were told and that's what they believe in their system. So doctors are afraid to give up false hope, right? If they would rather say, oh, you're only going to live 3 months, that way if you live 6 months, that means you have a good doctor, right? But if you say 6 months and they'll live 3 months, that means the doctor did something wrong. So they're always going to tend to underestimate how long you're going to live. That's an ego thing. And an interesting study done in humane research by Dr. Richter. He put streetwise rats that he captured outdoors and put them in water and had them swim until they died. And they only swam for 15 minutes and died. But they took other rats and kind of put them in water and then pulled them out and cuddled them a little bit and put them back in and then pull them out and kind of dried them off and warmed them up, put them back in. Those rats swam for how long? 60 to 80 hours. Why? Because they had hope. You have to give your patients hope. Read Anita Moorjani's Dying, I forgot the name of the book, but Anita Moorjani is an important book for you to read. These are foods for cancer, Dying to Be Me. So Dying to Be Me, Anita Moorjani. These are foods for cancer protection. And here are more. Thank you, Donnie Yance, the Mederi Foundation. So optimal nutrition is central. A whole food, plant-based, organic diet with a lot of crucifers are important. Avoid animal and cow milk products. Eliminate sugar processed foods, high sugar foods. Lots of coconut oil and olive oil. Drink water and green tea. And because of my clinical experience, at least early on, I recommend eliminating grains. Maybe after things get stabilized, a little bit of low gluten grain can be reintroduced. And of course, you'd want that to be whole grains. And of course, optimal nutrient supplementation is important. Now, at the initial visit, should the patient do a fast? Well, if they're hypermetabolic, remember if they're anxious, panic, those individuals don't do well with like a 7-day fast. They burn out quickly. But if you have a more vegetative type of individual, they'll never be more motivated than right at that point. And I had a patient or read the story. The book is A Crack in the Cosmic Egg, J.C. Pierce. His wife had end-stage cancer. He brought her home. Everything had been done. And they did 11-day followed by a 10-day fast. And he read positive messages to her continuously over that 21 days. And he reports she was healed by that. So alcohol and wine is 100,000 times more potent than resveratrol. So don't drink wine for resveratrol. And, of course, alcohol is going to boost breast cancer, right? Because it's impairing liver function so you don't get rid of estrogen as effectively. And likewise, Roundup, generates toxic oxalates, which interfere with estrogen metabolism. And again, estrogen promotes autoimmune inflammation and angiogenesis. 100% of cancer biopsies had more oxalate than the non-cancerous ones. It's a toxin, and it's also a marker for impaired detoxification. So chronic exposure is promoted malignancy. And you can check urine oxalate creatinine ratio perhaps first thing in the morning or do organic acid testing. So causes of excess oxalates, well, you need vitamin B6 for that key pathway. Too much copper is problematic. A high oxalate diet. For example, I was having a spinach smoothie every day last year. My plantar fasciitis wouldn't heal. Problem, oxalate crystals in my plantar fascia. So also genetically modified foods, mercury, and lead, yeast issues also lead to problems with this. So mold toxicity, mold is a very potent toxin, so you do want to eliminate mold. Exercise is important. After Cancer Care by Dr. Mole and Dr. McKee talks about this, how key that is. This is the one treatment that's more effective than chemotherapy, okay? There's exercise, and it's free, right? So look at this. Walking 30 minutes daily, reduced mortality 50%. With that, reduced death 56% in another study. So a lot of research there, but also with prostate cancer, reduced risk, and also with colorectal cancer. So you want to be walking to the point where you're short of breath, that you can only get 1 sentence out. If you can get 2 sentences out, you're not walking fast enough, right? That's the speed of walking you want to be doing. So intense exercise, marathons are exhaustive. They actually promote inflammation. So, I had a patient with triple negative breast cancer. She was doing well until she started training for a mini marathon, and then that triggered inflammation, and she got much worse. Sleep is critical. Natural killer cells can effectively kill cancer cells, but just a single night of 4 hours of sleep reduced natural killer cells 70%. And 6 hours per night or less was linked with a 40% higher cancer risk. If you do night shift work, there's higher breast, prostate, colon, and endometrial cancer. In fact, in Denmark, they will reimburse you for breast cancer if you get it from night shift work. Sleep-deprived mice had a 200% increase in speed and size of tumor growth. So there's safe ways to support sleep. These are the ones that I would suggest: inositol IP6, melatonin, passion flower, look at that, the chamomile tea, simple thing to do, magnolia with hanakal are some of the ones I particularly use. There's a progress report that has 67 mind, body, spirit recommendations that I put together, and also has 14 cautions like avoid cortisone. We're going to talk about that in a second, I think. So you can email me or you can contact SpectraCell to get my most recent version of the progress report. And these are books that I recommend that you read. Hope Never Dies, The Healing Platform are two more recent ones that I particularly like. And then After Cancer Care by Dr. Lamoille and by Dwight McKee. So strong relationships are as important as smoking and obesity, mortality. Meta-analysis, 148 studies showed the influence of social relationships comparable to smoking and to obesity. Right? So yes, no cortisone injections or pills in these patients because that's going to suppress the immune system. The exceptions being right before taxane chemotherapy, it actually can be helpful there. And then emergencies like with glioblastomas to get the swelling down. Breast biopsies, you want to do it when estrogen levels are at the lowest. So you don't want to do it on day 14, right? You want to do it during menses or just a day or two or so after that. And then you want to minimize estrogen levels by using vitamin D, zinc, B6, and so forth. After menopause, first drain estrogen. I had a patient who postmenopausal. We had a 9-centimeter goose egg tumor in her breast. I put her on Femera, 2.5 milligrams. That's an aromatase inhibitor prescription. There were two others, Aromas and Arimidex. They're also okay. I put her on that daily and purposely waited 3 weeks to allow time for that tumor to shrink because 90% at least of the postmenopausal breast tumors are estrogen receptor positive. And sure enough, by the time she arrived, I had that cryoablated. It shrunk to 4 centimeters, which was actually 1/10 of the volume of the original tumor, and it was much easier to treat. I had a more recent one, 2.3 centimeters, that shrunk to 1.5 centimeters at the time of removal, and those patients are doing well. The first one I mentioned, 8 years out, doing great. So biopsy can actually increase metastasis. Estrogen promotes metastasis risk, and again, estrogen deprivation may shrink the tumor. So especially important in those cancers that are listed. Avoid unnecessary surgery because removal of the primary tumor may activate dormant metastatic cells. Maybe as many as 50% of breast cancer patients may have cancer cells hanging out in the bone marrow, just sitting there, not causing any problems. But you have surgery done, that can activate those tumor cells. And you don't want to have a double mastectomy because that creates double the wound. I mean, it's stressful enough to be in the hospital and be getting surgery. And the bigger the wound, the bigger the message to go out and grow new blood vessels to heal the wound. Well, if you have tumor cells out there, they get the message to grow new blood vessels as well. And so that can promote metastasis growth. As I mentioned earlier, look at fresh tissue specimens to guide chemotherapy, preserve tissue specimens to also guide chemotherapy through CARES, and helps. Those are actionable tissue markers that you can look at. Surgical implants are not a good idea. Don't believe me? Read The Naked Truth about breast implants, Susan Kolb, MD. It's additional surgery, which is stressful, promotes any metastasis that are out there, and it can trigger eventually, if not right away, an autoimmune response, which produces a lot of symptoms. Chemotherapy in the days leading up to chemotherapy, you can use some anabolic botanicals to kind of strengthen the body, protect against the hemoglobin A1c dropping during chemotherapy treatment. And actually, if you stimulate growth of the tumor, that's a good thing because chemotherapy goes after those rapidly multiplying tumor cells. This is really important, you want your patients fasting 24 hours before and after chemotherapy because it puts the healthy cells in a dormant state, and so they're less susceptible to chemotherapy damage. And right after you get chemotherapy, if you eat, that's feeding these tumor cells that are halfway dead, and they say thank you. Or you can starve them for 24 hours, and they can go ahead and die in that situation. So 24 hours before and after, if they can't manage complete fast and do 100% coconut oil, maybe 2 tablespoons up to 4 times a day at those times. And I had a patient who said 56 chemotherapy treatments. She did this, and she found that she had no fatigue when she fasted before and after, and she'd always had constipation alternating with diarrhea. She didn't have that after fasting before and afterwards. So with taxanes, angiogenesis strategies that can augment prescription metformin, Celebrex, and platinums, remember magnesium tocotrienols, with radiation, it can benefit certain cancers, but in many situations, that actually can stimulate cancer stem cells, and many cancers, again, are driven by cancer stem cells. Leptin promotes cancer stem cells, remember, and then chemotherapy and radiation do not effectively kill cancer stem cells, and therefore can often promote metastasis. These are some of the things that protect against that. These are others, and if you want to get a list of 50 or more nutrients, then go to the Vital Strategies and Cancer.com website and enter the code word SpectraCell, and you'll get access to that, and also about another 100 slides if you'd like to look at them. The sympathetic nervous system, huge in cancer. It's activated by depression, social isolation, social status. It increases heart rate, triggers arrhythmias, anxiety, insomnia, raises blood sugar, clotting risk, infection risk, depression, and it reduces blood flow to the gastrointestinal tract, reducing acid production and nutrient absorption. It reduces liver function, therefore increases estrogen, and promotes proliferation, metastasis, adhesion, migration, cell survival, and angiogenesis in cancer. And also, remember, the natural killer cells are protective against metastasis, and stress suppresses those. A severe life event or severe difficulty associated with a 9-fold greater recurrence risk, so relaxation strategies are really important. These are some of the ones that you can use for that purpose. There are nutrients that are helpful there. These are ones that I use in my practice, and these are benefits with the Nostal IP6 and more benefits. You can look at these later. Ashwagandha. Now, be careful. For example, breast cancers, 90% of the time, ashwagandha can be helpful. But if you don't do Curious testing and don't know that they're androgen receptors, and that 10% that has androgen receptors, ashwagandha might make things worse. But particularly with uterine and ovarian tumors, ashwagandha is a consideration. Lots of benefits associated with it. L-theanine, amino acid that's in green tea, promotes GABA, processes the blood to protect that. So improves cognition, focus, sleep, and mood, neuroprotective, inhibits cravings, has cardioprotective effects, other benefits. But look at this, anti-cancer stem cell, protects against invasion, chemoprotective, chemoenhancing, and anti-metastatic with chemotherapy. So that's a good choice to consider. Look at all the tumor markers that helps address. Rhodiola helps give energy. That's my top choice with fatigue in cancer patients. It blocks angiogenesis as part of its mechanism of action. It hits nuclear factor kappa beta. Chamomile tea is the major source of apigenin, which has a lot of benefits listed there. So particularly for gastrointestinal cancers and to help with leaky gut issues, that's helpful. Of course, propranolol you can use, and a number of studies have shown benefit with propranolol, particularly right around the time of surgery, perhaps combined with a COX-2 inhibitor. And most tumors are estrogen-driven, so you want to be blocking estrogen wherever you can. And, of course, eating sugar, and because we're larger, and for all these reasons, we have higher estrogen levels, and it leads to all the issues that I've demonstrated, I talked about it earlier. And nutrients that lower estrogen are listed there. And, again, progesterone and cancer stem cells, both progesterone and progestins promoted cancer stem cells. So important to remember. Breast cancer causes prescription drugs, calcium channel blockers. Look at that, 77% increased risk overall. And angiotensin receptor blockers, even worse, right? Increased risk, 397% in premenopausal women. Insulin promoting as well. MTHFR associated with a 70 to 82% greater breast cancer risk when you're homozygous. You can test that through SpectraCell. And so initial support protocol can look like this. And you can look at this later, obviously, right? Those are good books there at the bottom by Donnie Yance that I highly recommend. These are overall nutrients that are especially important, are listed there in order of importance. And these are nutrients to avoid, pretty much in the order that I would recommend that you avoid them. So treat lactic acidosis. Again, check urine pH, target 7.0, 7.5. Those are some strategies to consider in that situation. With advanced tumors, you can consider an alternate week Artemis-based protocol. Most cancers, the ones that are hot, I see good success with that. So, I put on a conference once a year. You're welcome to come to that and learn more about that. Tetrathiomolybdate can also be a good strategy in stage 4 to help lower copper levels to achieve permanent remission. And then ablation therapy in combination with immunotherapy. Dr. Jason Williams has a new book out that you may want to look at there. He feels like within 2 or 3 years, he may be able to treat or cure 90% of cancers. Let's hope he's not too optimistic about that. So follow your intuition, have your patients, increase positive emotions, embrace social support, give them spiritual support, improves quality of life, longer life. So view cancer as a messenger. The life you live, provide all the ingredients to create cancer, so change. It's a growth opportunity, so thrive. And I love Annie Brandt's quote here, the nature and speed of healing, including spontaneous remission, correlates strongly with a person's beliefs, attitude, spirit, and enthusiasm for life as much, if not more than, their specific diagnosis, tumor pathology, and treatment protocol. Not everyone can be cured, but all can be healed. Okay, key message there. Blessings to you. Thank you so much for this opportunity to present.
Thank you, Dr. Roach, for a wonderful presentation. We are currently out of time for questions, but we have captured your questions and will follow up with you. Have a wonderful evening.